This part of the DVD describes the healthcare system in England. The healthcare systems in the rest of the UK will be similar but not exactly the same. Healthcare in England is divided broadly into three types. Community care. This includes general practitioners, family doctors, pharmacists, opticians and dentists. Hospital care for planned treatment. This care will be for more serious illnesses. Most hospitals are divided into the following: clinics, specialist outpatients, and investigations such as blood tests and x-rays. Wards, where you would stay for treatment. The accident and emergency section of the hospital is for emergencies only. The National Health Service, or NHS in England, is mostly free. If you have difficulty speaking or understanding English, you can ask for the help of a face-to-face or telephone interpreter at all NHS services. You can also ask for the written information to be in another language. The NHS GP or family doctor is the main way to get medical treatment. It is very important to register with a GP close to where you live as soon as possible after arriving in England. Your local doctor's surgery or GP practice provides a wide range of family health services. If your condition is non-urgent, you can expect to see a doctor within 2 working days, or a health professional such as a nurse within 1 working day. If you don't need an appointment within 2 working days, you can also book in advance if this is more convenient for you.
Mr. O'Neill, please. Morning. Come in, please.
As you can see, our patient has been called by the GP into his office. Here, the patient will tell the doctor what seems to be the problem, be it an illness or an injury. During the conversation, the GP will decide how best to treat the problem.
Quite soon.
If the GP thinks it necessary, they will write a prescription for the patient. This prescription needs then to be taken to a pharmacy, where the medicine will be dispensed for a small fee.
Okay, and obviously come back and see me. Is that right? Okay.
All pharmacies in the UK display this logo. Pharmacists, sometimes called chemists, are experts in medicines and how they work. They play a vital role in providing quality healthcare to patients at your local pharmacy. You will find a chemist in most shopping areas. Pharmacists can also sell you medicines for simple conditions without seeing a doctor. The pharmacist will dispense your prescriptions, provide a range of services related to health issues, and can give advice on healthy living and minor ailments. As we can see here, our patient has handed his prescription to the pharmacist. The pharmacist will then check the prescription, sign it, ask the patient to sign it, and then ask the patient to wait while he prepares the medicines. Sometimes the patients will be asked to come back at another time to the pharmacy to collect their medicines. When the medicines are ready, the patient will be called over by the pharmacist, who will explain to you what each medicine is.
Have you had any of these items before? Or no, it's the first time. This is thyroxine for your thyroid gland. Yeah. Just take one in the morning. Yeah. Doesn't matter that it can be before or after food. Just one every morning. This is the inhaler for your asthma. Yeah. This opens up your...
Most people will have to pay for a prescription. Currently £7.20 per item, which is about 799 rupees.
This is for your blood pressure. Yeah. And then just for one of it could be in the morning as well. You might feel a bit tired when you first take this for the first few days. That soon passes. Yeah. Okay. Any questions at all? No. You're quite familiar with it. Thank you very much. Any problems, stop back. Okay. Thank you.
Other NHS community medical services include the opticians. The optician will check your vision to see if you need glasses or any specialist lenses. The optician is free on the NHS, but you will need to pay for any glasses or contact lenses. The dentist. The dentist checks your teeth and gums to ensure that they are being maintained to a healthy and hygienic standard. The dentist is free for basic checkups on the NHS, but you will have to pay for more cosmetic treatment. If the family doctor thinks your problem is serious, he might send you to the hospital. This can be done in one of two ways, either urgently by ambulance or by asking the hospital to send you an appointment via the post. The family doctor may also send you to the hospital as an outpatient to have other tests done, such as blood tests, clinical investigations, or an X-ray. For hospital clinics or investigations, you will mostly have to report to the main reception, where you will be told where the outpatient clinic is situated. This is where you must bring in your papers and sign in to be an NHS patient. This is also where you will come or phone to book an appointment. Please note that very few doctors or their staff speak Nepali.
There you go. Right, that's lovely, thanks. Yep.
If you have to go to the hospital for an outpatient appointment or clinical investigation, please remember to take with you any current medicines or any medical papers that you might currently have, and please let the staff in the clinic know if you cannot speak English and they should arrange for an interpreter to help you. At the outpatient clinic, you will be asked to wait and will be called in to see the specialist doctor or consultant. Doctors will see you in private in their own rooms. You can bring someone with you if you would like to who can speak English, but you do not have to. Please remember that you may have to discuss sensitive information with the doctor.
By kukris, all different types, hats.
The doctor will then decide, after talking to you and examining you, what course of treatment you will need, if any, and will then communicate this to you and your family doctor.
It's a good thing if you're doing gymnastics and you're actually very supple, you're what we call double jointed.
If you need to come into hospital to stay as an inpatient, you will be placed on a ward. If you are admitted to hospital, you will need to always bring the following with you: the letter that the hospital sent you, your medicines that you are on, and this is very important, clothing to wear during the day and at night, including slippers and shoes, things to use in the shower or bath, a towel, soap or shampoo, things to wash with like toothbrush, toothpaste and deodorant, things that you like to do such as a book or a music player, a small amount of money if you wish to buy newspapers or sweets, and orange or lemon squash to flavour the water. When being admitted to hospital, do not bring with you the following items: anything valuable, for example jewellery, watches or necklaces, your mobile phone, or your bus pass if you don't need it to get home. Please be aware that most hospitals can only allow 2 visitors per hospital bed at any one time due to the lack of space and the need to maintain privacy. Please respect this and ask your visitors to come in at different times.
Is it better? Yeah, that's fine. Okay. Okay. If the doctor was coming in to see.
You may also need to come to the hospital in a medical emergency, such as chest pain, blacking out, breaking a bone or blood loss. This might be because you have had an accident, or a medical condition that you have has got much worse. You can travel to the hospital by car, or you can call an ambulance by dialing 999. This is for emergencies only. You will need to know exactly where you are, the road name and building that you are in. If possible, ask someone who speaks good English to make this call, as there will be a lot of questions to answer. Once you are at the emergency department of the hospital, you will be seen quickly by specialist nurses and doctors. They will treat your problem and decide what is best for you. Please ask the Gurkha Welfare Centre or others at your local ex-Gurkha Nepalese community to show you how to call for the emergency services. The fire service and police can also be summoned with the same number.